Close your eyes and imagine a world where tranquility and wellness are just a breath away. Welcome to our sanctuary of relaxation and rejuvenation. But what if you could carry your sanctuary with you wherever you go? Introducing our mobile app. Access a wealth of yoga classes, guided meditations, massage collections, and self-care techniques right at your fingertips. Create your own oasis of peace, anytime, anywhere. Download our app to embark on a path of tranquility and self-discovery. Your journey awaits. Namaste.
Hello, welcome. Today I'm going to be doing a calf and foot massage for the lovely Michelle, and I'm going to go ahead and dive right in. Sometimes when I am starting calf work, I actually really like to start with the feet because it can make everything else a little bit easier. So I'm going to go ahead and start with just some simple compressions. This can also be really grounding if your client is feeling scattered or they're kind of in their head. Really just encouraging all this soft tissue in the feet to soften. And even the most ticklish person, usually compressions like this feel really nice. I find that the more active my client is, the tighter the calves tend to be, just because the feet are, always doing something. And the feet and the calves are obviously very connected. And the first thing I think, if people are having chronic pain in their calves, and they're on the sides of their, this is a pretty common spot, in that gastrocnemius on the outer part. You get really good shoes. It can really help. And I'm gonna go ahead and just kind of bring these compressions into the outer part of this muscle, gastrocnemius. And I'm gonna work my way up the middle, that soleus a little bit. It's a little more challenging to work on that inner part of that gastrocnemius, but this is just really nice. Using most of my thumb, not just my finger pad. This little C-clamp is just really effective for lots of different things, but especially something like this. And I am going to work my way down around that Achilles heel. And back into the feet. And I'm going to grab my oil. And I'm going to go ahead and just get hopefully all the oil that I need, so I don't have to keep going back for more. I'm going to work on this tibialis a little bit to help with the anterior part of the foot. I bring that release around the whole leg. just a nice soft fist all the way down the sole of that foot. Because I'm working on the tibialis a little bit, I'm gonna focus on the anterior part of the foot as well. So I'll go ahead and start with this left side and just making sure that the foot's nice and anchored. I'm gonna go ahead and hold with my left foot, my left hand, I mean. And I'm able to have a lot more finesse with my hand if I use a really soft fist. So I don't usually, most of the time, I don't really tuck my fingers under. I keep them nice and relaxed. And I can kind of go in here in a more fluid way. And just working this soft tissue. Like to just turn my wrist a little bit, getting into the below the toes. I don't really use my thumbs unless I have to. So I'm gonna go ahead and work on the top part of this foot. Just doing little circles can feel really, really nice. And kind of travel up into that tibialis muscle, help everything relax. And just pulling. Go ahead and give these toes a little bit of love. I like to pull a little bit just to release the toe joints a little bit. And you can also go in between the joints, in between each toe. It's a really great thing to do for the feet in general. Squeezing more on the anterior part of the foot. And if I try to not forget what I did on each side. So I think I'm gonna go ahead and just do this right foot, and then I'll do the rest of the leg work. Kind of more or less doing the same thing on this right side. And again, just keeping my soft fist really, really soft and fluid. I try to give massage the way that I most enjoy receiving it, and I've never enjoyed it when like people have used like a really intrusive feeling knuckle in my feet. I think it feels kind of not that great. So I like using a gentler approach, even though I'm nice and firm. Just little circles on the top of that foot. Feel really good. You do really need to anchor the foot somehow, or it's going to be like flopping around everywhere. So just holding the toes a little bit to kind of anchor everything. This is not the best body mechanics, but for this technique, I don't really worry about it that much. And I'm gonna go ahead and focus on these toes a little bit. I like to just pull a little bit for the joints. And just keep in mind that any work that you do on the feet is gonna like directly help the muscles in the legs and the calves and the interior part of the lower leg. And don't be afraid, like when I just did that pass, I don't feel like I got a super good connection in between these joints. I'm gonna go ahead and do that again. Focus a little bit more that space in between the toes, the front side of that foot. You can also wiggle a little bit if you feel like there's a lot of, it's kind of sticky, just stuck. And I'm gonna start my work in these calf muscles. So I think that budgeting time is just really important as a therapist. So my goal today was like 15 minutes. And so at this point, I'm just kind of thinking about techniques that I can use on both legs at the same time, more or less, so that I can kind of budget my time a little better. So I'm just gonna go ahead and go in with a soft fist. This is a pretty fail-proof technique for the calves. It's a little bit harder if you're working on a person that's not really tall when you're shorter yourself, but making it work. And not forgetting about that inner portion of the gastrocnemius. And I am going to go ahead and do one leg at a time. Just working from the base of the table. I'm not going to move around too much just for time's sake. And I already have some really great techniques that I can use without moving around a whole lot. I like to just do a little bit of cross fiber work just by rotating my soft fists a little bit. And the longer that you do massage, the more sensitivity you get in, you know, using a soft fist, even using your elbow. I remember when I first started using my elbow, I felt like I just had no clue what I was feeling, but definitely adapt. And so I might do a little bit of more detailed work here with my thumbs. I'm just gonna work my thumbs up. I am moving my thumbs because it's a really good distraction technique, and I just really feel like I am more effective than moving right up along that muscle. I wanted to spend a little bit more time on the tibialis, but I think I'm just going to do just a gentle pass over that muscle for now. Try and kind of honor my time. And nice little stretch in that side, and I'm gonna finish with this right side. And like, honestly, if you would feel more comfortable, like sometimes I will put one leg on the table or just kind of position myself in a way that's more comfortable, and it's perfectly fine just so long as you're not crowding your client. If I only have time to do more detailed work on one side of this muscle, I usually do the outer part. So, just kind of depends on how everything feels. And before I forget, I'd like to thank a few of our patrons. I'd like to thank James C., Michelle B., and Caitlin. Thank you guys so much for your support. If I had more time, there's a lot more that I would like to do for Michelle, but we'll just have to wait until next time. And it can be really nice to just do something to tie it all together. I'm gonna go ahead and end with a few compressions in here and call it good. And that is all for today. Thank you for joining us today. If you enjoyed today's video, you should check out our Patreon page where you'll find some exclusive content. I look forward to seeing you there.
Join us for 14 and 30-day programs, hour-long classes, and much more on our yoga app, Yoga Plus by PsycheTruth. It's free to download and features a variety of wellness content, including yoga, fitness, Pilates, guided meditations, and interviews with dozens of wellness experts.